No.
Happy Thursday, everyone. Thank you for joining us for another webinar. We are Mint Ops. I am Alex Zlatin. I am the CEO. And tonight I have the pleasure of hosting Lani Ray, who is our Director of Operations for our Remote Administration Division called URDO. And tonight we are gathered here to talk about the administrative tasks. We're going to talk about, um, we won't be able to talk about all of them because there are a lot. We will talk about the two types of tasks and how to manage them in a way that creates structure and order instead of frustration and chaos. Um, I'm going to be moderating the webinar, so if you have any questions or anything, please do submit the questions through the platform. I will try to hold all the questions until the end, unless something comes through that is extremely um, relevant and would supplement what it is that we're talking about at the moment. By the end of the webinar, we do hope that you will be able to analyze and assess what's happening at the front of your clinic, and you'd be able to at least take some minor steps towards structure and order, a little bit less stress and drama, hopefully. The webinar is being recorded, so you will be receiving an email with the link to the recording so you can share with your colleagues, with your peers, and also review some of the information in case you need to step away. But do feel free to ask questions. We do prefer the webinars to be as engaging and interactive as possible, and we're here to help you guys just succeed and be a little bit happier um, at the jobs, whether you're an administrator, a clinician, a person that does both. It is very difficult, and we do want to support you as much as possible. So we will get started right away. I'm going to share my screen so you guys have access to the slides. One thing to mention though, if you are joining us on your mobile, then please make sure that you're able to swipe back and forth between the video feed and the slides. If you are only seeing the video, then it means you'll need to swipe left or right in order to see the slides. But you should now see our first slide on the screen. Right, Lani, we have it?
Got it. Perfect.
Fantastic.
Hello, everyone. Thanks for joining us today. Okay, so the admin tasks that shouldn't be at the front desk and who should handle them. So a topic that I'm very passionate about with helping clinics. So let's get started.
Awesome. I think before we dive into any solutions or any structures, we really do need to talk a little bit about the problems. We need to establish a baseline so everyone's on the same page in terms of, what are the issues that are faced and why are we oftentimes behind on everything. So a lot of times when I speak with offices, I do get to hear a lot of the generic issues, like I'm feeling overwhelmed, there's never enough time, but it doesn't really give you an explanation as to what the issues are. So I have to look into the data, I have to speak with different team members to understand what is the patient flow, what is really happening with the work, who's responsible for what, to really identify what is happening and uh, where's the breakdown. Things like, these particular instances I hear them all the time from administrative team members, um, but they are not um, the issue. The issue is not these words. These words are just a description um, to chaos that is happening. There's just so many things going on. Um, the administrative team is doing everything all at once, and it's very difficult to verbalize really um, what are the things that are happening and why are they breaking. So, Lani spent a lot of times working at clinics and then through the URDO platform behind the scenes with the administrative teams. So why don't you kind of share a little bit of kind of the day to day, maybe from your experience, at the offices and then as you're supporting them remotely?
Most definitely. Thanks, Alex. Yeah. So, I mean, like Alex is saying, the front end, the administrators are overwhelmed. They're busy. It's always fast paced, but then nothing ever is getting fully completed because they're dealing with phone calls, patients coming in, checking them in, making sure they have the correct coverage information. Then from there, more phones are ringing. They're checking patients out. Um, you know, Back end members have questions. Everything's happening all at once. Plus, then they have all the other tasks on top of that they, are wanting to get to, like their lists of recalls or their outstanding treatment or sending those pre-auths for patients that just left. And, it's just like Alex is saying, it just becomes a big problem. And at the end of the day-to-day gets done, but when do all these other tasks get done? Or even is the day-to-day fully getting done, right? So, and it's something that it is a big problem and people aren't realizing it. And a lot of times then, like Alex was saying, when now I see from a different perspective with URDO, we are being reached out to once it's really a problem. Their lists are huge. They need help and they don't understand why it got to this situation in the first place, or how I should say. And that's why it's so important to be able to maybe dive deeper into this to understand and, solve some things before even maybe you need the extra help, right?
Exactly.
Yeah.
So, if we are looking at, what is making it so busy,
Exactly.
we've put together, this definitely not exhaustive list of
Yeah.
tasks of work that the teams are doing up front. And, definitely this covers quite a bit of work. But if you look at this, we're not even talking about, you know, calling for collections, staying on hold with insurance companies, managing recalls, these big lists that everyone has, coordinating treatment, having those clinical conversations with patients, explaining to them why the treatment is needed and why it needs to be done earlier or within a timely manner. They didn't even, qualify to be on this slide. This is just kind of, you know, let's put together um, just a list of some of the tasks that are happening. And it's interesting because what we have found is that we oftentimes have to uh, classify the tasks into categories and then tackle them in a different manner and not just tackle the things that come to you as they come and just because you have context switch, you're distracted, you spread your focus into three things at the same time, and it's very challenging. um, yeah, the time goes by pretty fast, but it leaves you feeling unsatisfied, unaccomplished, it's just not good over time. That's why there's a lot of burnout as well on the administrative side. So, hopefully, as we progress through the webinar today, we'll be able to kind of give you at least our perspective of how to classify the tasks, and what you need to do, maybe even tomorrow, uh, and help you get things in a better shape, in a better structure.
Definitely. Yeah. Do you know something else I thought of that we see a lot too that makes, the front end so busy? And I don't think, clinicians realize that, do you know what, when they're booking every single one of their patients on the hour, for example, you have 4 hygiene providers booked on the hour. That means at let's say 3 p.m., 4 patients are going to be coming out to be checked out. Do they all need, they all need to be submitted to insurance, collect their portion, book the next appointment if it wasn't done in the back? Do estimates need to be sent? But in the meantime, like I said previously, other patients are coming in for those same appointment times. If there's only 2 girls, they're already backed up, right? So yeah, it's something that isn't always thought of, but it affects everything in the flow of the office. So yeah, so here's a typical 60 minutes. Incoming phone calls, insurance checking, like we said, checking in and out. And like I was saying earlier, the staff coming and asking, this patient, how many units of scaling do they have remaining? Like there's always extra questions. Or where's my next patient? This patient's late. Okay, let me check in. But you're in the middle of checking out a patient. Where's the priority, right? Obviously, whoever's in front of you, but it's a lot of tasks, always all at once. So.
Yeah, that's exactly that. And clearly, this is, again, not an exhaustive list, because imagine, you're being on hold for 45 minutes now, carrier, and as the patient is checking out and wants to pay and leave, um, the insurance rep picks up. Now you have to make a decision, what is more important. Um, Hopefully, you pick the patient in front of you. But it's very frustrating that you will need to call the insurance company again and wait another, however many minutes. You can be on hold with the insurance carrier, see the patient, and then also get an incoming call from the lab that you work with, asking questions about a case you sent them. Maybe something's wrong, maybe something's missing, maybe there's a delay. Um, you know, if,
Yeah, exactly.
if you are on that call, you're checking out that patient, and you miss that call from the lab, you have to remember somehow to actually call them back. Um, and at the end of the day, uh, a lot of the tasks are not structured nicely, um, like I showed them before, but they're structured more like this, one on top of the other. There's I really wanted to put a juggling kind of a meme of some sorts, but I just felt that it would be a little too much. I think, the people who are watching this webinar, there's a reason why they have registered. They understand, if they are administrators firsthand, how overwhelming that is and frustrating. And if they're not admin team members, then for sure they at least understand how they feel. Everything is always the top priority. Everything needs to be done right away. And unfortunately, there is no real structure, because everything does need to happen right away as much as possible. So I think when you're looking at how to make those divisions, we found that the best way to do this is to classify this into 2 categories. And we have the work that has to be done right away. It's typically very quick. It's typically done in person. And it's just the day that has to be done to keep the day going. So for instance, checking out a patient, it has to be done in person. You take a payment. Sometimes you book their next appointment. Sometimes you answer a question. Sometimes you ask them a question. The interaction is fairly fast, and it needs to happen so the day keeps progressing. And then there's what we call the quiet work, and it's work that requires a quiet place, a quiet time, It's work that requires a little bit longer because you need to focus, you need to reference more than one source, you need to be really focused on it. Otherwise, some accuracy is being lost. And that work potentially is maybe data cleanup, maybe some reporting, definitely managing recalls. If you get interrupted, it's very, very difficult. It's very difficult to even remember if you were able to complete something with this patient. If something comes up very urgently, the phone rings. Um, so when we divide this, um, and we will later on talk about how to identify if the task is of which type. But maybe Lani, you want to share a little bit about kind of the two groups?
Definitely. So like Alex was saying, the face-to-face, that's obviously the most important, and an impression on your clinic as well. You want to really focus on the patients that are in front of you, but you also want to do your best to answer every call. You don't want to lose your calls either, and that could be an important call about your schedule in the day, or a patient might be running late or something's happening. So that's also saying what helps keep the day moving. Those are all very important, but hopefully can be quick tasks, but they aren't always quick tasks. Even those face-to-face, patients, when we're exiting them and they have more questions about a pre-authorization, and that gets to be going even deeper into the, insurance portion of it. And, are these things that maybe we need to be able to take that into a consultation room, a private area, and discuss this. Sometimes too much is being done at the front, and that's where you need to, evaluate what can be done that's not, fast paced, and can be done, somewhere else. And then, of course, like it says, you need 5 to 15 minutes for something. And I love that Alex gave the example of recalls, because that's something that so many people think, okay, in between patients, I can go through and do some recalls. And they think, oh, it's calling. Yeah. Yes. And it's something I'm very passionate about, as you all know. But with recalls, yes, it is calling, but you should be also looking at all of the data, checking when were they last in, is the date set correctly in the system, does it show the correct recall line, does it show the correct hygiene line? Then from there, what do the notes say in the clinical notes? What was recommended by the hygienist? What does their coverage show? Do we have that breakdown? Then maybe you're making the call, right? So there's all those little details to even making recall calls, recall hygiene calls, right? So, and that takes more than 5 to 15 minutes, right? Same thing should be done that thoroughly with treatment planning, right? With doing anything with treatment. And then, of course, we get into the AR end of things, like Alex was saying. And, that definitely shouldn't have interruptions, especially if you're entering a big, EFT, electronic funds transfer payment from an insurance company, 10 pages long. You can't be interrupted, So these are all things that definitely need to be delegated differently, right? Between the now work and the quiet work.
Yeah, and there's some things even more complicated than this. Imagine, you had maybe a temp receptionist or a receptionist that didn't work out. She didn't really know what she was doing. She did a little mess with some of the billings. Imagine you have to reverse engineer it. You have to untangle this. This is something that is very, very difficult to do when you're at the front desk. Really being distracted. Distracted is the wrong word. It has a negative connotation. Being distracted by work items. But still getting out of the focus that you need to really retract back all of the steps, and untangle some incorrect billings, is something that requires a lot of time, a lot of effort, a lot of focus, and it's very complicated. And it requires that dedicated time away from the front desk, day to day. Yeah.
Mm-hmm. Yeah, most definitely.
So if we're looking at how to see if a task should or can, well, maybe should is a better word, should be done at the front or should be done elsewhere, when you have the dedicated quiet time, these are the three questions that you need to ask yourself about the task. You need to say, do you need to handle this in person right away? So these things, again, we're talking about taking a payment. Patient in the waiting room coming to you, asking you a question. Um, these things, they have to be done right now. Um, the length of the task, we say under 5 minutes. In all honesty, sometimes you begin a task and you think it's going to be 3 minutes and you end up spending 20 minutes on it. It happened to all of us. It's very difficult to know exactly the length of what something would take. But as you go through, it is obvious sometimes that a task is going to take quite a bit of time. If you have, 250 patients to call for recalls today, it's going to take some time. So uh, apply some common sense. And again, 5 minutes, maybe you work in a larger office and you have, you know, maybe four, maybe 60 members at the front. Okay, fantastic. Maybe this doesn't need to be 5 minutes. Maybe it's 7 minutes because there's always someone who is able to address, patient questions or check in, check out. Maybe there's a dedicated person for that. In smaller clinics where you oftentimes have one receptionist at the front doing everything, maybe this needs to be down to 3 minutes because still things are happening at the front that are urgent and need to be handled right away. And then the third one is a question is, are you only using one system? Is this task, for instance, just with your patient management software? Or is this just in, let's say, Sun Life portal? If it's in one system, then it's good. If it is not in one system, we recommend a dedicated time and place because you now need to be logged into everything. You need to access everything. You need to have two screens, maybe a big screen, whatever, because you have to reference things. And again, it requires a lot of attention, a lot of focus, and it's easy to make a lot of mistakes. And our rule is if you answered no to any of these questions, then you have to treat it as quiet work. So, does it take less than 5 minutes? No, quiet work, right? Is it only in one system? No, quiet work. So you want to make sure that you are answered yes to everything if you want to handle this at the front, in person, urgent right now, under 5 minutes, and in one system.
Yeah. And you can even think there's a lot of tasks nowadays that we can do within our communication software system. And yes, it communicates back and forth between the dental software and the communication software for texting and emailing. But some of them, when you're dealing with the recalls, like I was saying earlier, or the treatment, and you're going back and forth between the two systems to check that, like Alex said, it's not quick work anymore. So that's something that maybe it needs to be, dealt with in a quiet workspace.
Exactly. So yeah, what should stay at the front? Again, this is not really an exhaustive list. So don't take a picture of this slide and bring it to your boss and say I'm only gonna be doing this. Again, you have to apply common sense and understand how this information relates to your clinic, and then make the necessary adjustments. But yeah, Lani, do you want to go over these things? Maybe add some from your
sure.
experience to them.
Yeah. So, I mean, obviously, it's like we were saying earlier, the greetings, the check-ins, the checkouts, taking payments, providing quick estimates, which is, a lot different than saying, okay, I'm going to send the estimate, I'm going to go into detail, all of those things. Quick estimates where it comes up right when you send it electronically. That's the difference, right? Same day schedule changes and urgent messages. So, I mean, when you're up front, that's happening all the time. Patients call, they need to move things around, things need to be changed. And that a lot of times is what your hygiene or treatment coordinator is spending their time on, is filling last minute schedule changes, last minute openings, right? And then simple questions and requests, patients that are in front of you or the phone ringing. And like it says there, phone and emails, and we also think of text replies, right, that affect. And some of these text replies might not be something you need to deal with right away. So how do you prioritize that, right? It's not pertaining to maybe today. And same with the emails. Maybe you have patients in front of you and the phone ringing. What do you need to deal with first, right? It needs to be put in a list into an order of what is most urgent, what needs to be dealt with right away. And then, of course, walk-ins. We all know with between walk-ins and emergencies, right? That's something else that, patients, it's very important when you have someone that is in pain that we deal with and help them as well, right? So, and then of course the vendors, public, we have suppliers coming in, and that's it becomes very busy, and all of those things, when those stay at the front, that's your full day right there.
Exactly. And it's interesting, on the vendor side for walk-ins, our team walks into offices to talk to them, at random occasions, depending on which city they're at. And we are seeing the front team really being accommodating. And we're also very mindful of we do ask if what on a scale of 7 to 10, how chaotic is your day, because we understand it can never go below 7. But we are mindful, but we are seeing that there's a lot of accommodation to just walk-ins. Clearly, they don't really know the person, so they might be a new patient walking in. But even when they know we are a vendor, they're very accommodating, but sometimes that comes at a price, and especially in days that are a little busier, you should feel completely comfortable saying, what, today is really, really crazy, let's chat tomorrow or next week. And it's completely okay, because you have to prioritize and you have to be able to control your time.
Really do. Yeah. And it all makes a difference too, like you were saying earlier, if there's 2 admin or 3 admin up front and you have more specific tasks, then it helps, right? If there's a greeter and then someone that's doing the exiting, that really makes a difference. But then there's all these other tasks that we keep bringing up that we'll go through, as well, that when are these getting dealt with on top of it, right? Yeah.
Yeah, exactly. So if this stays at the front, then what should go into a quiet place somewhere else? Well, these are, again, not an exhaustive list, but a list of probably some of the more important and larger tasks that should be moved to a quieter spot with dedicated time. So, Lani, I don't know if you want to talk about these points.
Yeah. So insurance checks, that can include for your benefits, limits, frequencies, pre-approvals, insurance verifications, all of those things should be in a quieter spot. And then you get into a lot of things too. There's private information. You're talking about waiting room can be busy, staff in the back is around. So yeah, it's definitely something. And then even as we go into other areas, recalls and reminders, like I mentioned, that takes time. And if you're working the lists and doing the outbound calls, you need a quiet space. You need where you're not being interrupted consistently, because you will never get through, like Alex was saying, those hundreds of patients on that list, right? Same thing with the treatment coordination. If you're constantly being interrupted, how are you following up with all those pre-authorizations that were sent? All of that treatment that maybe did book back and canceled, or didn't have that follow-up set once that pre-authorization was sent, right? Same thing with your balances. If you're not collecting at every appointment, there's going to be a balance and you need to follow up. The further that balance goes into 60 to 90 day plus, it's harder to collect, as we all know. And then, like Alex was saying too, then it starts taking more investigating work. That takes a lot of time as well. And or is there refunds? Is it insurance refunds, patient refunds? That takes time to investigate, look into as well. And then referral packs, record requests. we've all seen this in a clinic where a patient's being referred to a specialist. You know, one of your clinicians comes up front. Okay, I'm referring this patient to, you know, this practice for, you know, this specialty, and a lot of that's private, confidential information. But it's also pulling something else that they're pulling that, you know, admin team away from. Maybe there's someone else in front of them, right? So it's all things that definitely should be done in a quieter spot. And then data cleanup for sure. And your reports, your daily reports, your weekly reports, your month-end reports, right? Those all take time. They need full concentration, and should definitely be something that you're not being pulled away from all the time.
One thing, as you were talking, it occurred to me, you know, we have on the recall and reminders, we mentioned outbound calls. So, you know, as we look at the task and we see whether it should be done at the front or somewhere quieter, you want to look at outbound calls. Almost always should be done in a quieter place. The difference between outbound and inbound is that outbound requires preparation. You want to review the patient file. You want to review, maybe there are other things you need to speak with the patient about. You want to look if the data is clean and you're able to actually have the right information when you're calling. You have the time to prepare before you call, and you much rather be prepared when you call them. Otherwise, it does look unprofessional. When there's an inbound call, you have no preparation time. Someone has called, so now you have to figure it out on the fly. These are things that happen at the front, but in the back, in the quieter spot, side office, or even at the front, but a dedicated time when you're away from the counter, you're able to prepare, review everything, and then the work gets done in a more effective way, more efficient way, less awkward calls where you don't have the right information. And it's just better. So when you're looking at something, at a task that requires outbound calls, I think it's safe to assume to put that already on the quieter side for dedicated time.
Most definitely, I agree. I think that's at the top of the list there, and it's something that, you know, a mindset needs to change with a lot of clinics, because it's very important, and you know, it makes such a difference to getting your appointments booked. Like you're saying, Alex, being able to have that time to thoroughly understand what the patient needs, what were they last in for, all of those things, like you said, doing that investigative work before you make the call is huge, and it makes all the difference. And yeah, really helps.
Yeah. Also, what I find is that, and we'll talk about it a little bit later tonight as well, part of the preparation requires collecting all kinds of notes and history from different places, just because different team members have put that in different places within the software or the patient file if you still have paper charts. Sometimes you have to aggregate all of this, all of these pieces of information in order to actually make the right judgment call on what needs to be discussed with the patient and when. So that requires time, and in a lot of instances, you do not get this time when you are at the front dealing with everything else. And the side effect of that is that all of this work that we see on this slide gets prioritized lower than the previous slide for things that should be handled at the front. These things kind of slip through the cracks. They build up into large lists. And at a certain point, it becomes so large that we are not even quite sure how to start tackling that because it's so large. And it feels that you can never actually complete it or even make a dent in that big list. So I think a lot of the feeling overwhelmed is just understanding how much work there is and without a proper structure and planning and execution, it is um, it's quite likely that you'll be struggling within these areas of the work within the clinic.
Yeah, and then exactly, I love that you say that. And that is so important to understand, because if your chairs aren't booked and you ask your front admin team, have you been doing recalls? When do they have the chance? They don't most of the time. And that's the thing. And even if they do, they're spending most of their time, like I said earlier, filling those last minute openings. So when are they getting to the list of patients? And if they're thoroughly working on those lists of patients consistently, you're going to have a short notice list. It's going to be easy to fill those last minute openings, stuff like that. It's so important to be able to have. And it's that snowball effect. And then they don't even realize that these things aren't being done consistently or thoroughly until, like I just said, openings start happening. The AR has reached over 90 days and it's an absolute mess. And it's not even because these team members don't know how to do these things. They do. There's just so much backlog now.
And even, even if they do recalls, what does it mean to do recalls? If they called 5 patients today from the list, does that mean that they did recalls? What is the threshold? Is it 7 patients? Is it 17 patients? No one has made any of these definitions because, does it really matter how many patients have you called? What matters is how many patients were you able to book. And, if you are doing this between the tasks, then you are calling definitely less patients than is needed to actually make enough bookings. And that's when it starts getting worse, because then the lists keep getting larger because every day there are more patients that are due than you are able to book. And if that's the case, every day your lists will grow slowly. But if they grow slowly every day, in a year, you can see a list of 400, 500, 600, 700 patients. Very busy clinics. We can see even 2,000 patients that are overdue. In some very large clinics, even 3,000 and 3,500. So it all starts, on the first day where you are able to book less patients than patients who become due today.
Right. Being able to do it, and then, like you were saying, Alex, having those valuable calls, actually being able to book the patients, right? It's not just a quick call. It definitely is not, right? So, and a lot of times too, you call mom and then now you're booking 5 family members. You cannot do that. That takes time to find spots that work for everyone's schedule. Same thing when you're exiting a patient and you're trying to book a family back. That takes a lot of time. So, where is that time to actually make those calls and book?
Yeah, it's you get interrupted. That's the problem. And then it's difficult to get back to it and remember where you left off. And you have to do this many, many times in a day. That is the biggest challenge that creates those feelings of being overwhelmed and not in control.
And then, like you said, the things falling through the cracks and wondering what happened. So, yeah.
Yeah, exactly. So, we came up with a few ways of how different clinics with different structures can actually create that quiet space. Sometimes offices are built to maximize clinical space, and then you don't have an extra office where you're able to sit with patients or even sit by yourself and have that dedicated time. But you are still able to do it while still sitting at the front. And again, if you are the only receptionist in the office, this will get very, very difficult. But if you are a team of two or more, then definitely these things can make an immediate impact on how much in control you are with everything that needs to happen at the front. So when we're looking at blocks in the schedule, so we're talking about shorten each day. So think about it this way: you have 30 minutes in the beginning of the day, and then 30 minutes towards the end of the day. That is 1 hour every day that is dedicated to manage those lists. And you can say, okay, Monday is going to be, collections, and Tuesday is going to be treatment, and Wednesday is going. So you can mix and match whatever works specifically for your clinic, but you are blocking that time to make sure you're able to work on those items that require more focus. You can split the day. Again, if you have a dedicated space, then you leave, because it's easier to really disconnect from the front if you physically leave. Again, if you're not able to, then at least block it in your time. You don't have to make it short. You can make it half a day. That will get you to make a bigger dent in all of those quiet time activities. But that does require you to have other support at the front to do all of the tasks that we talked about, from patient check-in, check-out, answer the phones, walk-ins, etc. You can also rotate. So, we started with short blocks. We went into medium blocks, which is kind of half a day. And then also you were able to rotate. Again, if you have someone else, one day the person, their full day is at the front, the next day their full day is doing the quiet tasks that require more focus. If you are watching this webinar and you're managing, two clinics, maybe you're managing 5 clinics, 10 clinics. Sometimes some of the clinics also have a larger space to work from. You're able to set a dedicated group to then be able to work on the quieter tasks for all of your clinics. That can be an efficiency um, structure, and it will allow the team members who are at the actual individual offices to focus on the patients and on the things that's in front of them. The teamwork component, to me, that is the most important one. Again, if you are the only receptionist at the office, that you can communicate with the other people, but at the end of the day, you're alone up front. But if you are 2 team members or more, the communication, you don't have to have dedicated time, specifically for anything. If you communicate and you understand, you work on the same data and have the same priorities, everyone knows that, hygiene is a little slow. We have big lists. Okay, let's allocate, this time you're going to do this. The next day I'm going to do that. Communicate to make sure everyone knows what priority each team member is working on. That piece to me, is by far the most important one. You can block anytime you want, split your days, whatever. If you don't communicate what it is that you're working on, it's very difficult to have that synergy that is needed, especially when you are dividing the work into those two sections. And also the last one is to get help. A lot of times front teams are understaffed for the amount of work that the office has. But this needs to be something that can be talked about with the manager, with the owner. Clearly there's an additional overhead for another salary if we are adding a team member. So it's not that the existing administrators just wants to be helped and they don't want to do the work. They are doing all the work, but there is a lot, and sometimes they need help, and it can be an additional team member. but it also can be outsourced to a service like you are the one that Lani is spearheading for us. Um, so it depends on what is the clinic needs, you know, how many team members, what is the area that requires the most help, and you know, obviously we have at least one consult per day with clinics where we dive deep into their data and try to understand, you know, what is the area where we can help the most with, because we can't address everything right away. We have to start with the one with the biggest impact
Mhm.
and then continue from there.
That's
Um, yeah, Lani, anything kind of to add about different ways of how an office can kind of split, figure it out, divide the
Yeah,
work?
these points were wonderful, and I've seen them work well. But as we've all seen as well, working within the clinics, you block a day, or you split a day, or you rotate, and then someone's sick, or someone ends up going on mat leave, or changes a position, and now you're always short again. And then you're looking for more team members, and as we know, that's not always easy now, and we're already short staffed, and our lists are already running behind, and everything is kind of falling. So, and that's where exactly that, you know what, this works when the team communicates and you have everyone working together, and the, you know, the right team members, and none of this happens. But you know, in a real world, these things do happen. And that's where, you know, if you're communicating that, you know, I haven't been able to get to recalls this week, I've gotten to maybe 5, then it actually is communicated, instead of months later, when or you know, 6 months later, it's going to really reflect and show. Not even that, it only takes about a month. But you know how the cycle is with recalls. They're going to start to see it, and unless that was communicated, it's almost too late. And now we're doing problem solving, and you know, that's where we're being reached out to. I'm being reached out to for help, um, and you know, to see if there's need to help with outsourcing. And like Alex was saying, having a consultation with the clinic, that's the first step in seeing, okay, where can we, what is lacking, where can we help? Let's like look at your data, let's look at your processes, you know, can we maybe outsource some of that to you or do? And that's that first consultation part of the first step of that. And then from there we evaluate, you know, your numbers, what needs help, like Alex said, what's priority, and then go from there, with possibly outsourcing it as well.
So I think also, as we're talking about making changes, I know that no one likes to make any changes. That is the top reason why change management fails. It's because the natural tendency of people is to not change. We do want to propose some guardrails. You know, it's just a set of um, guidelines or rules or whatever you want to define them as, um, rules of thumb just to follow as you are uh, implementing change or even considering the change. You know, Lani mentioned a couple of times in today's session about privacy, sensitivity of information when we are interacting with the patients, face to face, but also over the phone. If there are other patients around that are hearing this, that is a risk that you are exposing the clinic to. Uh, there might be, you know, a neighbor, an ex-boyfriend, whatever, who's sitting in the weight room listening to this information. Then that information can be used as leverage in whatever other things happening in the life of said patient. You know, when you're talking about treatment, when you're talking about any diagnostics that were done, financials, and even personal information of like moving addresses. You know, imagine there's a stalker. For some reason, the stalker and the patient goes to the same dentist. Shocker. Um, that's kind of the definition of stalker. If they are sitting, if the stalker is sitting in the weight room and the patient is telling you that they have now a new address and they're saying that address now is known by the stalker.
Uh,
Um,
I love, and these are extreme cases, but you never know, like you're saying. But it's crazy because we take so much pride and we are educated in this industry on privacy and what to share and what's confidential. But it's amazing how it's never thought of at the front desk.
yeah, exactly. But again, there's so many things going on. It's very difficult to think of the exact everything that is happening. But this is why this is the first guardrail. I think it is extremely important to actually take this very, very seriously because this is unnecessary risk that the clinic is exposed to. So think about it, allocate space for it. Sometimes you get the luxury of not having anyone in the weight room. That's also okay. Um, but if you do, just be careful and do use um, some sort of an office that's that you have a door that you can close. It is very, very important. And yes, although what I described is a very extreme case, there were cases that had complaints to privacy commissioners almost in every province now that are similar to what I described, although less extreme. Um, Another guardrail, losing tasks. How do we remember to do something? Do we live in the world of sticky notes? Do we have, a notebook? Do we use the software? Um, what are we doing? And the biggest question is, does every team member know the exact same thing? Or they all have their own interpretation, their own understanding of where notes are kept, what needs to be documented, in what structure should it be documented. These things are extremely important. Not everything can and should be documented in the software. In the software, we want to document primarily things that pertain to the patient. Sometimes you have tasks that you need to be doing that are not patient specific. So you might not want to document them in the software, but where do you document that? And how do how does the rest of the team know? Let's say that you have a list of these things you need to do, and then you're going to be sick for the next few days. These tasks still need to be done. And does the team know where to find those? Um, these are very, very important pieces that, if not done correctly, would cause um, things to slip through the cracks. And sometimes it's small, and sometimes it's big. Um, but these things build up, even if they are small.
Yeah, it's so important, like you said, Alex, and especially, I mean, notes. I'm so big on notes. Anyone that knows me or has worked with me, I mean, you have to be. When you talk to a patient and there's certain information that they told you, and they call back, where are you looking? Are you all, like Alex said, are you all knowing where to look when that patient calls for that certain information? Is it regarding financials? Then it's in maybe one section of your dental software, right? If it's regarding the clinical end of things, then we know to check in there. Is there a template for that so that you included everything that should be in there, which is also very important on many different areas, as we all know? But does that include your next visit? Does it show what is going to be next? If that patient canceled their appointment and that appointment got deleted, it wasn't saved in the system, we don't know what to book, and there's a bunch of outstanding treatment. Now, it's very important making sure you have notes in the right place, you all know where they are, and that, like Alex is saying, having templates, and not just, we see them all the time for the clinical end, but is there templates for how you want your notes when there's certain calls? Is there templates for even when you're sending, email and text reminders to streamline that? Makes it so much smoother in all areas.
Exactly. And the less places we have to look for, the less time we spend when we have to prepare for an outbound call, as we mentioned before. For change management, I'm a big proponent of checking whether what we're doing is actually working. Try to take 10 minutes once a week and review, am I and are we as a team following this change that we have done? And if we are, is it working? And if we aren't, what is preventing us from implementing? Maybe the change needs to be different. But without taking a moment, zooming out, it is very difficult to see whether the change is working or even if we are implementing the change, because we haven't built a habit yet and we have past habits. So this is very, very important as a guardrail to actually make sure that things are happening and they're happening and causing the right type of impact that we want.
Yes, I agree. This is something that I find is so important, is to making sure, okay, we made this plan so that you're able to do these tasks, but is it ever followed up on and reviewed? So then we don't understand why maybe those tasks weren't being done because of certain things. So yeah, very important. And I love, even like it says here, 10 minutes weekly to follow up.
Yeah. I think everyone can allocate 10 minutes weekly. If you've already taken the time to review everything and make changes, if you've already taken that effort, 10 minutes a week would help you stay the course, and if not, correct course in the right direction. It's not always possible to have these guardrails of backup. We all live in the same industry. We know that we are all understaffed on the clinical side, on the admin side. But cross-training, making sure that the team members can help, whether you're away sick or have to leave for an emergency or just need the extra help for a little bit. This is very important to have people know where the notes are, what it is that you're working on, the priorities, and why. It is crucial for the operation of any business. You never want to have one point of failure. It's just very risky. And again, the alternative is to outsource some of the tasks. You cannot, outsource a person that's going to smile to the patient when they walk in. This needs to be a person who believes in the values of your clinic and loves the patients and wants to provide that level of service. But there are certain things that you can and even should outsource for a more effective outcome and less stress for your team.
Yes.
You have to think about that.
Mm-hmm.
We have a couple of minutes. I don't see a lot of questions coming through, but I do want to quickly go through the small changes. I think it's very important to leave our audience with something a little bit practical that they can use, maybe even tomorrow. From the list of the quiet work, I'm pretty sure what items you are doing that you wish you would be able to do it with a dedicated time away from the day-to-day chaos. Pick 3. If you want to start even smaller, pick 1. And structure it in a way where you have the dedicated time to do it. Create the proper record-keeping template and share that information with the rest of the team so everyone knows where to find things, what is going to change, set the right expectations, and then set a time promise. Just make sure to say, okay, we're going to start, October 15th. Why? That's why we decided. We're going to prepare everything ahead of time. This is the date we're starting. And, it's a time promise. So try to promise yourself to start and start. Um, and as you are doing the moves, you should expect these three signals to see, and this will be kind of your beacon, your lighthouse, I guess. You'll see a calmer reception area because some of the things, depending on whether you choose one, two, or three of these tasks to move, but you will see a more calmer area with less chaos. Um, you'll see less missed calls. You'll see quicker smile turnaround to a patient because you have less things on your mind that are pressing. And then you'll see cleaner data, which will help you when you're looking at reports, when you're trying to figure out, what is the next, highest impact area that we need to address. If you have dirty data, it is almost impossible to know for sure. But everything in your data would look nicer when you start structuring the templates and you communicate to the rest of the team how to make notes, where to find them all, how we're going to be using it. And all of it results in really, really good uh, feedback. But these are the signals that you want to watch for. And if you see them, then you're on the right track. If you're not seeing them, just review again how you're doing it. Maybe the note template's not good enough. Maybe you need to start with a different task to begin the changes first. And always we're always here to help and recommend things on how you can do things better. At your office. So we are kind of 2 minutes over, but I don't know. This is our contact information. Really appreciate any reach outs from our industry. As people maybe recording those. Lani, you want to kind of wrap up maybe some last thoughts on the matter?
Definitely, yeah. It's something, we could have talked about for, it's good to cut it into an hour, but, we could have went even further into, but it's a good starting point that we're sharing. And I think, making those little changes can help. And then if you're seeing that, there's more issues, reach out if you want to do a consultation with me and maybe dig deeper into, maybe what else we can help with. And even if it's not so much for you or do to help with, let's see maybe what's happening and that first step of me taking a look at the systems and maybe what's needed. Maybe you don't need URDO. Maybe it's something else, and I can pinpoint that as well. So yeah.
Definitely. Okay, perfect. Well, we will just wrap up. Again, thank you very much for everyone that have taken an hour from their busy day. I hope this was beneficial for you. Again, if you have any questions or anything, feel free to reach out to us. We're always happy to support our industry. We will see you at some of the next trade shows. The next one is Todd's in Kelowna next month. I'm going to do an educational session as well there, as well as attend the trade show. So if you're around there, please do drop by. If not, we will see you probably at Spectrum Day Toronto in November. And then we'll see what's happening next. Or you can catch some of our next webinars as well. We would love to have you attend those as well. But yeah, thank you very much. Have a great rest of the evening. And we will see you soon.
See you soon. Thank you. Thanks, Alex.
Thanks, Lani. Bye-bye.
Bye.